In today's video, we're going to go over the PCR basic layout, and I'm going to go ahead and start in from the dashboard. I'm going to go ahead and click here on the plus sign to get my PCR to pull up. And as you can see, it's loading up my PCR. So this is a video to go over the basics of what the PCR form looks like for our agencies to be able to show their people when they bring them in as new hires or just as a refresher. Now, a quick note on that, just remember, each agency has set up their PCR a little bit different than some of the others. This is the general form that we have in test agency, just to show the basic things that this will do. So there may be some features turned on in this that you do not have in yours, or you may have some features turned on in yours that are not in the test agency. So as long as we know that going forward, we'll be able to kind of look at this as a general broad overview of what the PCR looks like. We're going to talk about the different pieces of the PCR. We're going to start down here and talk about some of the tools in here. And then we'll go ahead and jump to the top over here on what we call the quick action tools. And then we will talk about the different fields, the tabs on this side. And then we'll go ahead and finish up with what is referred to as the power tools on this side. Okay, so let's go ahead and jump into this and get it going. As you can see on the bottom, if I had a patient's name, this is where that would show up. This information right here, the patient care report number, this is a ImageTrend specific number that is created specifically for each PCR that's created, meaning it's almost like a fingerprint for this PCR. And that's an internal number that ImageTrend can use to look up the runs or can assist us to look up the runs as well. Validation tool, simply put, this is a countdown to help us to figure out what all needs to be done on the PCR. Let me go ahead and show you. It's a great tool, and one of the first ones I'll show you, the ImageTrend is built in to help us. At the bottom, it says 74. This is basically a count, and each item in the PCR that's been turned red has a number value to it. As you answer these, this number will go higher. The goal is to get it to 100 and turn it blue. So, that being said, anything in red needs to be addressed. Arrows take you places, and they'll take you to the specific part in the PCR that you need to address whatever it's saying still needs to be done. Pretty neat tool, and it's kind of cool as you're starting to learn how to get from place to place in the PCR. The PCR itself is pretty intuitive. It's going to turn things on and off as you ask it to. It won't get ahead of you, and that's a neat thing about it. So going forward, you can see that there's different things here. So as an example, let's say this location type is needed. I'm just going to click on that arrow, and it takes me to that part of the PCR where the information needs to be put in. So again, the validation tool is a really good place when you're first starting out to learn where things are. Now, these two have to be answered in order for you to go ahead and save your PCR, or what we call post. And I'll cover that in a few minutes. But just know that these two pieces of information have to be recorded in order for you to save this to move forward and look it up later. Now, where does the red come from, and how do we get it on here? Everything red, again, needs to be solved, and your goal is to turn this to 100, blue, or gold. The must rules are labeled in red, and they have to be answered. Your agency may choose to do some in gold, which is considered a soft rule, and those are suggested to be answered. So, as we talk about the red and possibly gold, again, where did those come from? Why are these things red, and why do we need to answer them? NMSIS is the national standard for EMS. They create the vast majority of these things that are required for them, which is why they're turned on as red. The state of Texas may have specific things that they're searching for as well. Those will be turned on as red. Your home agency may also have some things that they need turned on as red. Another agency that has a lot of input into this is CMS, or otherwise known as Medicare. So these agencies are looking to collect the information that helps them to do their jobs better. Now, what does that mean to us as an in-care provider? It also means possible funding possibilities by showing that we make certain runs, certain numbers of runs, even to the point, if you're in a big county, you are making runs on one side of the county a lot more than where your stations might be. This allows your agency to be able to use that information to go to their funding agencies to collect more information and more funding possibilities to build things like stations, get new apparatus, more equipment. So that's where a lot of this comes from. The agencies that determine what information has to be collected. So again, answer all red, arrows take you places, and that's the basic premise of moving around in this PCR program. So let's go ahead and take a look at the next tool, the menu button right here. Go ahead and click on it. You can do multiple things from this. If I wanted to do attachments, I could simply click the attachments button. I could add new, and then it's going to ask me what do I want to do. If I'm trying to download a document, I can do that if I had one already. If I want to browse into my computer and pull something from there, I can. Or if I want to take a photo, it's going to ask me to access my camera. I can do that as well. Once I click that and say OK, it's going to download that information onto this PCR. Now, the neat thing about that is when the PCR is printed or emailed to your CQI or to whoever that happens to be for your agency, they'll get to see all that. Something that's neat about that attachment is, say, for instance, you're doing a transfer from a nursing home or you're a 911 service responding to a nursing home, as an example, and they have the face sheet. You could take a picture of that and attach it to the actual PCR if that's what your agency chooses to do with it. Some of the other things you can do in here are the addendums. If you had to make an addendum to your PCR, you could do it through this. Now, this may require it to be unlocked once it's finished and done, but your agency will have a point of contact that can do that for you. Associate fire incident. This is something that would allow you to look at a fire incident report that you created. Now, if your agency does this, starting January 1st, 2026, you'll know that we've moved to the federal nearest platform instead of what we used to use in the past, which was the federal InFirst platform. However, this is a way to contact that through this. Now, some of your agencies are going to do it in different ways. They may have it where you go straight to a different format, which is through ImageTrend to do your fire report. That'll be up to your agency and how they choose to do that. Okay, moving on to the lock button. It's exactly what it says. If you want to lock this report, you just simply click on that, and it'll give you the choice to lock it down. That way, changes can't be made to it. And then again, delete, pretty self-explanatory. If I wanted to delete this PCR, I could do that. Now, a side note to that, some of these things in this menu may be turned off to all the users. It just depends on your admin agency and how they choose to allow the users to interact with some of these features. Okay, so that is the bottom that we're talking about. Over here on status, this simply is just going to change as you move through your PCR. As we talked about, let's go ahead and go up to the top. It is important to save as you go. And so I want you to watch what it does on the save button when I do that. It automatically gave me that little save information. Now, why is that important? As I start moving from page to page, it auto saves for me. That's a neat feature. We'll start to see that as we look at these tabs on the left. Okay, so the save button. Again, you're going to get that little icon every time you click it. Post. This is simply if I want to take my completed PCR, or if I want to take part of it and I want to work on it later, I can post it to the server. Now remember, we're living in field right now, so this is the ImageTrend program that's designed to be on whatever it is that your device uses to connect to the internet. Some may even require you doing it in field, coming back to the station and connecting to the internet that way. That's okay. All of those possibilities are there as long as you're using field, and will allow you to post it when you get back to some type of internet. Now, if I were to click the post button, it's going to give me choices to do some things. This will pop up and it'll say, do you want to post this incident? Now, some agencies choose to have this already on, and you would have to unclick it if you're not trying to finish it yet. Or in this case, it's just set on to say, I'd like to post what I've already done to this point, not completed, to the server. That allows me to put a copy of what I'm doing up to the server, and then I can go back in and access it and finish it out as needed on the desktop version. But anyway, If I were to do it, I could click this on saying I'm done, which it will not let me do right now because I'm only at 74. In order to be completely done, this has to be 100 before I can post it with this check mark in there. If I try to do it before then, it's going to give me an error code saying that I'm not completed yet. Now, moving on, print, PDF, exact same thing. The print will show you the printed format and it does it in a new tab. PDF does the exact same thing except it puts it in a PDF form. All it's going to do is open up a new tab. So when I click on that, it's going to ask, do I want my EMS run reports with attachments? Remember how we went to the menu button and attach things? You just simply want the EMS run report, or do you want to run a test? CAD. So the CAD button is a neat feature. You can go ahead and if you're in here and you had to do a manual case and you have CAD, and let's say that CAD was down for some reason because it's a computer program and those things do get updated from time to time, I could come in here, actually find the CAD information that I needed, download it, and essentially merge it into my manual case. Now, if you're an agency that does not use CAD, then this button would not be up here and it would be turned off. That way, you wouldn't even have that option. The EKG button, I would simply click on this if I was trying to interact with my medical device, your 12 lead, whatever device you have, you can hook this up to draw information off of that and upload it into your PCR. It's a really cool tool. Get with your point of contact in your agency and they will show you how to do that. Transfers. This is another neat feature. If you're dealing in-house with EMS to fire, or if you're dealing with other agencies that are using Elite ImageTrend through our region, if they're using the same one, then you can upload your information to them, or they can upload their information to you and share it. AI Assist. If you happen to be one of the agencies using AI Assist currently, you simply click on that button and it's going to give you options to do different things. You can record or add images. It's a neat thing. If you hit record here, it'll allow you voice to text for 30 seconds. If you want to add an image, you can do that by clicking add image, and it's going to let you use your onboard camera to do that. If you generate values, it'll take whatever information you have and plug into the fields that it lists out for you. It's a really neat tool. I did another video on this, so please go back to the resources documents page, find the video, and you can watch that on that. Close. Obviously, if you're done with this, you can hit close. This will take you back to your dashboard. Let's go ahead and start to talk down through some of these tabs on this side. So ImageTrend and STRAC have created for the region what we refer to as an anchor page, and that is this rapid entry page. Now, the rapid entry page is designed to collect basic information throughout that are listed in some of these other pages that you can do on one page, and it helps you to quickly put the information in, take care of your patient, and then when you need to come back and fill in the rest of the information. So we're just going to walk through this real quick. My goal really isn't to do an actual PCR. I am going to walk through it real quick just to go through and show you how to interact with it. Okay, as we're starting to look at the left side of the page here, we're just simply taking a look at these different tabs and what they're going to open up, the different pages. This is where we're going to record a lot of our information about the patient, different pieces of information that are going to be needed as we complete this PCR report. So again, as reminded, I'm not trying to do a full PCR for you, but I am just trying to show you where everything is. Rapid entry, this is our anchor page that was developed. Now, anytime you go out of this or come back to it, it's always going to bring you to this rapid entry page. Again, we refer to it as the anchor page. It also collects a lot of information that might be listed in some of these other pages. And the reason that we have this to allow you to quickly collect information, put your device down, treat the patient, do the things you need to do, and then afterwards come back, pick it up, and actually knock out the PCR that you're trying to do. Just a real quick reminder, things that are red need to be addressed. Arrows will take you places. And as you go through, you'll start to see these drop downs that we have. And each of them give you the same information. It's just your choice of how you want to choose. So let's go ahead and jump into this. Emergency response area. I now have my choices I get to make. Single, multiple, none. I'm going to go through these real quick and kind of show you the difference of what it shows. Let's say that I get canceled or I don't have any patient contact, I can hit none, and it kind of walks me through some of these choices. Now, again, these were created by NIMSIS. The language that's used for them is NIMSIS language. As you practice with the PCRs, you'll become more efficient at learning the NIMSIS language and putting the appropriate one in for your PCR. So this is none, pretty easy. Doing a cancels pretty fast once you get the hang of it. Single just simply means you have one patient. The patient's name would go down here after we type it in, and it just brings in the information for one single patient. Now, if you were to do multiple patients, you could hit multiple, and the real difference between that, as I go back between single and multiple, is some of the things will change for you. As I hit single, you can see some of this information in here changes when I hit multiple. A lot of it's the same, but now I have a question about MCI. Is it one, yes or no? And then down here is the real big change. You can add another patient. So one of the key features to this PCR is I don't have to jump out and back in to the dashboard to work on different PCRs if I have multiple patients. I can simply do this feature, add as many patients as I have on scene. Okay, so let's go ahead and show how that works. I'm just going to create a patient one to keep things easy and click off of that. We can now see that patient one, my patient's name is here. I'm going to add a patient because now I have a second patient. It's going to ask, are you sure you want to do this? I'm going to say okay. And now it's going to open up a new PCR. What's neat about that is if you had information in there, case number, things like that, that'll move over to this as well if your agency has it set up that way. So in this case, this is our second patient, and we're just simply going to name them patient 2 to keep it straight. And now you can see patient 2. If I wanted to go back and forth between patient 1 and patient 2, I would go to this arrow right here, as you can see at the bottom of the page, and it lets me go back and forth between the two patients. Now it's loading back up the PCR for patient 1. So that's the neat thing to this. It allows you to go through and jump back and forth from each patient. So pretty cool feature. If I were to hit single, obviously it would just give me information for one patient that I'm working on. Okay, so that's a neat feature to that. As you kind of sail through here, you're going to see some different things, but to hit on some of the tools that have been added in, no patient contact, that is a preset value button that was collected. As you take a look at it, you can see that it wants to enter in some of the information for you. Again, that is known as a preset value. I could apply changes and it would simply drop it in there. The next tool that we're looking at is the scan driver's license barcode. If you happen to have AI Assist, you can simply do that with this by adding image. I would highly recommend, if you have the AI Assist button, that this is how you get the driver's license information. But to simply go through it, you can click this button or that one. If you use the driver's license barcode, it's looking for the outside camera of your device, wants to look at the barcode on the back of the driver's license. Once it gathers that information, it will drop in all that information into your PCR. The AI Assist, simply you can use any camera on your device, forward facing or away facing, take a picture of the actual driver's license, the front of it, make sure it's a clear picture, click that, apply changes, and it'll drop that information in there as well. Pulsera is another program that we're using in this region. It's become very popular. If you are an agency that does their Pulsera first, this is perfect for you. ImageTrend has built this button in, so you can take your Pulsera information, grab it, and input it into your PCR. Moving on, find repeat patient. If you're an agency that has repeat patients, as most do, that you get the opportunity to visit with from time to time, this is a great way to keep their information from crew to crew that is going through and meeting with them. For an example, let's say you've got somebody that has diabetes or heart problems, and you're the crew that makes that person. If you type in social security number, patient's name, date of birth, and this turns blue, then you'll want to go ahead and click on that. Find their name, download that information in. It's going to show you information from past runs that were made by other crews with that patient. Anytime you see a time button, That simply just means it's a tool to add at times. It'll drop into that second. So it's something that is at that moment in time, but you can simply open it up. It opens up this time tool on this side where you could change things if you need to, even clear it out if that's what you wanted to do. You can also see date of birth. It gives you a date of birth entry tool if that's what you want to do as well. So, for instance, another tool would be your weight entry. If that's something that you need for medication, you can enter in the pounds, it'll give you the kilograms, and vice versa. If you do kilograms, it'll give you pounds. Just another neat tool in there. Again, not something that's read, but just an extra tool that was thrown in there for you to help out. You can see some of your common zip codes. This, of course, was put in by your agency. These are ones, again, we're living in the test agency. So these are common ones that we use for training in this. As we move down, we start to get to different patient complaints, medical history. Something that's neat here, you can simply just add different things in here. It starts to list out the different medical patient history that they have. If maybe you put one in by accident, you can simply just X out of it. Other past medical history, you can simply type in. Let's say they have something like COPD, you can type that in, and that also goes part of their patient history. From their current medications, if this is something you need, you can use the AI Assist tool, which is really cool for this. When you do the drop down, it does give you these different choices over here that you can then choose that way. If, for whatever reason, you don't know what the medication is, you can click on the medication and it'll give you a brief description of what it is. It's a really neat feature. Not all the medications have it. We have close to 10,000 meds in there. If, for whatever reason, you have one that's not listed in there or that does not have a description, email us at support@strac.org and we'll get that added for you. Moving on, we're down to medication allergies. I am going to show you this one button because that's important. We do have a lot of patients that are not allergic to drugs, and this is a common terminology that we use for that. And of course, that's where that lives. As we move through the rest of the PCR report, you can start to figure out what to click and what not to click. All right, so we're just marching through this anchor page real quick, and you can see the information requested here is more about what we're going to do. Have we made patient contact? Are we going to transport? Have we evaluated? Things like that. The next page that we go to is the scene, and this just has basic information about the scene as well as what we're going through. There are places like this where your agency is going to put in the proper information for you. If you're making scenes with certain agencies, that's where this list will be for you to do. The dispatch unit crew page, this is going to list out your incident number, which is generated by your agency, and other information about your crew. As you can see, you can start to gather information from what your agency wants you to collect. If you have a CAD system, some of the stuff will populate for you. If you don't, you'll be doing a manual case and you just input the information as you go. Again, the things that are red, you want to address. The things that are not, only click on them if it makes sense for your agency to do so. And as you can see, this is where our information about our crew would be and kind of where we're going forward. And then the crew members. So the crew members, I'm going to take a second to show this. I can add it. When I do that, you can simply draw down the list of people in your agency and assign them their role. Key point is somebody does have to be the primary patient caregiver because everything that is done has to be assigned to somebody. So now we're moving into the patient information, demographics, insurance, medical history. These are just pages to capture that information needed by your agency and the PCR report to close it out. One of the key features on this, the demographics page, is if you need to list next of kin, this is where you would do it at. And again, that's at the bottom of the demographics page. Insurance, if your agency collects insurance, this is where you would do that. Very easy to use. Just put in the proper information. Also, AI Assist, you could take a picture of it and make that an attachment for the PCR. Med history is allergies. Some of this was already inputted from the rapid entry page, the anchor page earlier. The reason I showed this is because this is a little bit different. Environmental allergies is here, along with work-related injury. Conditions. Now we're starting to get into the condition of the patient, some of the things that we find, and we want to make sure that we document in the drop downs. Okay. If you have things that maybe relate to a stroke or time-related stuff, you can see that's here. Again, that time tool is there. Information about DNR. Now, NMSIS is very curious about injuries, and so they want to know about this. So you have to answer it to do it. But if you would look over here for a second, if I click on yes, you can see that the trauma page just came on. And what that trauma page is, it allows me to fill out information about the trauma. And what you'll notice is the red-blue criteria. If it's a pediatric, it'll actually change to the pediatric red-blue criteria. It's pretty cool in what it does. However, if I'm on the evaluation page and it's not a trauma and I click no, it never opens up that page, which prevents me from filling out extra information unless I need to. As you go down, you're going to see the stroke evaluation, possible STEMI, cardiac arrest, possible sepsis. Under stroke, to note, you can do multiple stroke assessments as you're going along. Some agencies require that you do one or two throughout your transport. You can do that here. As you click on these, yes, you can see that it opens up the corresponding page for you. If it's not something that you need to click on, just leave it blank and it'll never open up that page. Therefore, you don't have to put that information in there. I do stress this though. If you do have somebody that falls under one of these criteria, please open it up. Please fill it out. It just helps with the PCR as you move forward. Impressions, again, this is your impression of what's going on. You fill in the proper information. Interventions, these are the things that you've done. Now, again, this is the test agency. So I have interventions on the left where I can add different things that I'm doing. And you would simply just open it up and enter in the information as you go along. Now, the reason I say that on this, some agencies have chosen to turn this off. So if you're one of those agencies and watching this video, you may not have interventions. Your agency may choose to use the power tools, which collects the same information. ImageTrend just built it out to make sure that you had both options, or you could do either or. Again, in test agency, I'm just showing you what's here. Signature page. So this is where we collect the signatures for the crews and for the patients. Your agency is going to have the signatures that they want presented here, and they'll teach you how to do the signatures that you need to do. If you happen to use narcotics, this is where this would be used, and this is simply just a way for you to label them and show what you've done. Narrative, pretty simple. Whoever's doing the narrative can drop down in here. They can choose their name. It's going to show the current crew members. It also shows everybody else in your agency if somebody else happens to be doing the narrative on this. You want to give the proper recognition to the person doing it. As you start to go through, you can type your narrative and it'll turn it from red to blue. Some agencies have it set to do a certain number of characters. Some agencies also have these generated narratives. These are just generic ones that were built in, but these will, if your agency allows you to use them, grab information from the PCR when you're doing it. Usually the narrative is one of the last things you do. Some agencies have this turned off or have created their own. It's strictly up to your agency how they want to do it, but this is where you would collect your narrative information. Fire incident report. Some agencies have this turned on, some have it turned off. Currently, we're in the transition moving to NERIS, January 1st, 2026, and that application is actually being worked on currently. When that gets up and running, we'll kick it back out to the agencies so they can choose whether or not they want to use it. Power tools. On this side, you have your time button, pretty simple time button. As times need to be filled in, you can use the clock button to do it to that moment in time. If you're an agency that does mileage, this is where you would include that mileage. The timeline. Timeline is a really cool tool, and it is something you're going to interact with on every PCR. As you can see, even though we don't have much information in, it's simply going to list out chronologically everything that you're doing. If I need to go into that specific thing, I can simply click on that arrow and it's going to drop me into that specific item. So if I need to address something or change something, that's where I can do it. And that is just going to list out as you go. The cool thing about that is you have a filter system up here. You can turn on and off your view of right here to see certain things. You can select all and do that, or you can deselect all and do that. It just depends on what you want to show and what you want to have visible in your timeline. Again, make sure that you do some test runs, and then that way you can get used to how this works. Patient encounter. This only works if you use that repeat patient that we talked about earlier on the anchor page, the rapid entry page. If you use that repeat patient, you will have access over the last 90 days to go look at the information regarding that patient. If your pen pad or your device is connected to the internet, you can actually go down here and change the number of days to more, and it'll go back and actually find more days of information for you as well. It's preset for 90, and that is stored in the cache memory of the device, of the browser that you're using. So as you can see, this timeline actually has multiple uses, but the one you're probably going to use the most is going to be right here as you start to go through and make sure that everything lines up. Situations. So this was created as a situations tool for you to use to make things easier for you. If you have, say, a cardiac arrest, you can click on this. These are the most common things used during cardiac arrests by most agencies. These are just timestamps. So if you were to click on one, it's not going to fill out all the information for you. It's simply just going to show that you did this, and then you'll need to go back in and actually fill it in. So as you can see, my name is the primary caregiver, which we did on the dispatch unit crew page, and it's giving credit on my initials. If for whatever reason somebody else did it, I could change it, and I'll show you how to do that right now. So it's also showing the things I did. So let's say that I needed to go in and change this. It's simply going to take me to this page. Let's say in this case, I am going to switch to Jordan Gowie as the person that did this. So now I've changed that, and I'm jumping in to change whatever else needs to be done. In this case, it's asking for more information for me to fill out. So I would just fill out the stuff that needs to be done and kind of go from there. So we'll say 500 and okay. So now we've looked at the situations tab as far as cardiac arrest. You have one for sepsis. Again, it's going to show you that. Trauma, again, built out. These are all the same. These are tools to help you to jump in and quickly do timestamps that will allow you to keep track of things as you go. Again, just a tool. You don't have to use it, but that's why it was built in there for tools for you. As we start to work down, worksheets, this is where if your agency had worksheets, they would collect them in here. And that is simply the tool that you click on to get to your worksheets, as you can see. Some agencies have them, some do not. If your agency does, you'll be able to see them when you log into yours. What I like to do is go down here and hit the All button, and it shows me all the different power tools that I have access to. Now, I'm not going to go through each and every one of them, but I am going to show you the assessment button real quick and show you something specific about this. If you're going through and assessing a patient, be careful how you utilize this tool, because if you hit all normals, you're basically saying that everything has been checked and everything is normal. The reason I say that is these go into very detailed depth on each part that they're showing. So what I would recommend is just click on the one that you are trying to interact with, and you can start to see it starts drilling in on different things. So instead of clicking all on that, I'm just simply going to click on the things that make sense. Again, your agency may have different feelings on that, so please follow whatever your agency feels as that. But you can see how it's all listing out now as I'm interacting with it. Again, just going back to the power tools and listing them all out here. So, okay, so I've quickly done a PCR just to put it together so we can show the process of posting it out. I am at 100% my validation. So if I click on it, you're going to see that there's no other things I need to do, which is a real quick way to just make sure you're good. But again, if this is at 100, it means you've read and answered everything that's read or what has been asked by your agency to be filled in addition to what NMSIS and the state of Texas has asked for as well. So I'm simply going to go up. I'm going to post it here. It's going to give me this option. So if I wanted it to be finished, I could click on this In this case, I'm going to give the example if I'm not done with it. Let's say I want to go back to it later. I'm going to hit post, and it's going through the process of doing it. Now you're going to come to this. This is where some people make some mistakes, so I'm going to walk you through it real quick. When you get to this part right here, just go ahead, know that it was successfully posted, and hit close incident. If you do that, it's going to take you back to the dashboard. What some people do is they hit OK, and they're like, wait a minute, it didn't post, and they try to repost it again, and it creates a conflict on it, especially if you've done it as a finished PCR. So what I would recommend is either post it like I just did, hit close incident, or don't post from right here. Simply close the incident to go back to the dashboard. And here we are on the dashboard. Now I'm going to select it, and then I'm going to hit post. Now that I've posted it, you can see all the markers that are going to tell me that I've done it correctly. I have the blue cloud with the blue check mark in it, and it says posted. Over here, I have a 100 that's also blue, and that's a hint. Unless this is 100, you're not going to get a posted blue cloud with a check mark. It has to be 100. Also, this little circle with the green check mark in it, that tells me that I've posted it, it's gone to the server, and now we're good to go. Okay, so we went through this kind of quick. This was meant to be a quick, brief overview of a PCR. Hopefully I accomplished that with you and you stayed awake with me as we were going through this. The big thing is, as you get into your agency's PCR, the platform is going to look very similar because it's based off of the same thing, but each agency is going to have its little nuances that it has turned on or off. Make sure that you learn that for your agency. Ask questions to the point of contact that you have with your agency that is working with STRAC. If needed, have the point of contact in your agency reach out to the support team at STRAC. And again, they can do that at support@strac.org. We're here to help. If you have any questions, you have any suggestions, or other videos you'd like to see, please let us know, and we'll try to get on that quickly. We hope you have a great day, and we'll see you soon.